The Cowden Syndrome by Andrea Pinzo Ledispa, Medical English, Dr. John Moscoso. Cowden Syndrome definition. Cowden syndrome is a disorder characterized by multiple non-cancerous tumor-like growths called ormatomas, and an increasing risk of developing certain cancers.
With this disease, because patients with Cowden syndrome can often have funny types of polyps. So these are polyps that are not the standard type of polyp, also polyps that can be hard for pathologists to categorize. The benefit of recognizing Cowden syndrome is that we can both do genetic testing for this, and then once the diagnosis is confirmed, we can get patients enrolled in surveillance measures, which will reduce the risk of cancer long term. Hereditary cancer syndromes can be difficult to diagnose because the patient sitting in front of the physician or the patient themselves may not have had cancer, but they may only have a family history of cancer. If you're concerned about your family history of cancer, if there's multiple people in the family with the same type of cancer or multiple different cancers or cancers at young age, I would encourage you to contact us or the Department of Cancer Genetics and arrange an appointment to discuss this further.
Applications in medicine. Most cases of Cowden syndrome are caused by mutation in the PTEN gene. PTEN is a tumor suppressor gene. Mutations in PTEN result in a defective protein that is unable to carry out its normal role. This leads to the development of the various tumors and cancers associated with Cowden syndrome. Cowden syndrome is inherited in autosomal domination manner. This means that to be affect a person only needs a change in one copy of the responsibility gene in each cell. In some cases, an affected person inherits the mutations from affected parents. Other cases may result from new mutations in the gene.
I'm here today to talk about Cowden syndrome, which is a rare genetic disease. So I have a genetic predisposition to have tumors and tumors that can grow into cancer. I've been growing tumors all over my body. A lot of them were benign, but some develop cancer. It's underdiagnosed, so a lot of people will get 2-3 cancers in their life and they won't know they have the genetic mutation. My first symptoms, I started to have a big swollen foot. They thought it was a broken bone that didn't heal properly, but 8 years later, when all the expertise came in Canada about venous malformation, I got a diagnostic for this, and then I started to have tumors on my thyroid, tumors in my breast. I started having tumors in my breasts at 15, and then at 22 I did an MRI and it showed precancer lesions, so I opted to do a double mastectomy at 23 years old. It's really the risk management between taking a decision to do a surgery that will affect my life or to most probably get cancer. So the next step is my uterus. There's a very high risk of getting uterus cancer. So I'm getting a hysterectomy, so my uterus removed. For now, I get tired very easily. I have pain almost every day, so it's difficult for me, but I'm hoping to go back to work at some point. I'm having problems to see in the future. So I've been so in the moment for so many years that just to say, okay, what will you do with your future? I don't really know.
Approximately 99% of people who have Cowden syndrome will have vein growth on the skin and or in the mouth by the end of their 20 years old. People affected by cowden syndrome also have an increased risk of developing certain types of cancer: breast, thyroid, and endometrial, the lining of the uterus. Cancers are among the most commonly reported tumors.
FlashMed. What is cowden syndrome? Cowden syndrome is a disorder characterized by hereditary gastrointestinal malignancies, breast cancer, thyroid disease, and mucocutaneous lesions. It is associated with P10 mutations, protein tyrosine phosphatase located on chromosome 10. FlashMed has thousands of video flashcards on YouTube.
Issue applied in Ecuador. Currently, 25% of SC cases are believed to be caused by hermine mutation in the PTEN gene, which encodes the PTEN protein, a phosphatase with dual specific, homologous to phosphatase and tensine. When SC is accompanied by hermine mutation in PTEN, it belongs to the group of PTEN-associated amorphous tumor syndrome. Conclusion. In conclusion, Cowden syndrome is an inherited disease characterized by multiple known cancerous tumors. However, they predispose to the development of cancer, such as thyroid cancer, breast cancer, and endometrial cancer. In addition to the fact that syndromes can also develop more serious as Banyan Relay, Rubalcaba syndrome, and Proteus syndrome.